You feel fine, no chest pain, no fatigue, no obvious warning signs. But inside your blood, the story could be completely different. Right now, there may be silent markers, tiny chemical clues circulating through your bloodstream that predict heart attacks, cancer, diabetes, or inflammation long before symptoms appear. And most people have no idea they exist. In this video, we'll break down 7 silent blood markers you should know, what they mean, how they're tested, and why ignoring them could cost you everything. Let's get into it. 1. High sensitivity C-reactive protein, hs-CRP. Think of this as your body's inflammation alarm. C-reactive protein is produced by the liver when there's systemic inflammation, even at low levels. Chronic inflammation is now linked to heart disease, stroke, Alzheimer's, and cancer. A normal hs-CRP is under 1 mg per liter. 1 to 3 mg per liter is a moderate risk. Above 3 mg per liter signals high inflammation and high disease risk. If your hs-CRP is elevated, your body is fighting something, even if you don't feel it. 2. Lipoprotein A. The genetic heart attack risk. You could have perfect cholesterol numbers and still be at risk for a heart attack. Why? Because of lipoprotein A, or Lpa, a genetically inherited particle that promotes plaque buildup and blood clotting. It's rarely tested, but it increases heart attack and stroke risk up to 4x, even in young, healthy people. Ideal Lpa, under 30 mg per liter. Most insurance panels don't check it unless requested. If you have a family history of heart disease, ask your doctor for an Lpa test. It could save your life. 3. Homocysteine. The artery. Irritant. Homocysteine is an amino acid. In high levels, it acts like sandpaper on your artery walls, leading to atherosclerosis, blood clots, and dementia. What raises it? Low B12, B6, and folate. Genetics. Poor methylation. Healthy level. Below 10 micromole per liter. Over 15, your cardiovascular risk goes up significantly. It's a simple blood test and completely treatable with B vitamin therapy. 4. Hemoglobin A1C, the silent sugar snapshot. This test shows your average blood sugar over 3 months. Even without diabetes, a slightly elevated A1C increases your risk for nerve damage, vision loss, heart disease, kidney failure. Under 5.7% is normal. 5.7 to 6.4% is prediabetes. 6.5% and above is diabetes. Many people with prediabetes have no symptoms, but the damage is already happening. 5. Ferritin. Too little or too much iron. Ferritin measures stored iron in your body. Low levels cause fatigue, hair loss, and brain fog. But high ferritin is even worse. It triggers oxidative stress, liver damage, and accelerates aging and inflammation. Healthy range 50 to 150 nanograms per millimeter. Over 300 nanograms per millimeter equals inflammation or iron overload, especially in men. High ferritin can mimic autoimmune diseases and is a red flag for metabolic dysfunction. 6. APO-protein B, APO-B, the true cholesterol risk predictor. Forget just LDL cholesterol. APO-B is the protein on every atherogenic lipoprotein, including small LDL particles that burrow into arteries. It gives a direct count of bad particles, not just their size or weight. Optimal APO-B, under 80 milligrams per deciliter. Over 130, your risk of cardiovascular disease triples. If your LDL looks fine, but APO-B is high, you're still at risk. 7. GGT, the hidden liver and longevity marker. Gamma-glutamyl transferase, GGT, is a liver enzyme, but it's also a powerful oxidative stress marker. High GGT is associated with insulin resistance, diabetes, non-alcoholic fatty liver disease, early mortality. Even in the normal range, higher GGT predicts worse outcomes. Optimal GGT, under 30 units per liter. It's part of most routine blood panels, but often ignored. Don't let it be. Knowledge is prevention. Here's the bottom line. You don't need to wait for a heart attack, stroke, or diabetes diagnosis to know something's wrong. Your blood already knows. These silent markers are predictive, powerful, and preventable. Ask your doctor to run them. Track them. Take action early, because the best way to treat disease is to stop it before it starts.